So that's a common thing that we see, actually, patients that have chronic neck pain or headaches or both that have kind of failed all other therapies. You know, like they've maybe done shots or cortisone shots, they've done physical therapy, and they're just not kind of where they want to be. And it's not that physical therapy is bad. I mean, there's a lot of great things that physical therapy works on for strengthening muscles and improving posture. But if you're someone that still has a lot of neck pain with or without headaches, and you've done all the these kind of exercises, or you've got your daily regime where you kind of stretch in all the directions, and it's maybe just keeping your symptoms at bay but not getting rid of them completely, then prolotherapy is something to consider. And the reason why is because, like I had mentioned, physical therapy works really well at building muscles. You know, if it was just a muscle problem, physical therapy would have taken care of it. However, if it's just kind of maybe keeping symptoms at bay only when you do those exercises, or it hasn't helped you 100%, it's time to consider that there might actually be an underlying ligament issue. So ligaments are kind of the rubber bands that hold our whole skeleton together, and you have a lot of them in your neck because each vertebrae is connected to the one above it and the one below it by ligaments. And so if any of those had been injured from like a car accident or whiplash, or even just forward head posture, like kind of carrying your head forward, physical therapy is not going to be able to strengthen those ligaments. So with forward head posture, you've got to think of your head like a bowling ball, you know, and if you hold a bowling ball really close to your body, it's easy to hold, you know, kind of if your head is directly on top of your neck. But if you take this bowling ball and you hold it out here, or hold it out here, or hold it out here, it's going to get heavier and heavier and heavier, and you're going to feel more strain in your arms the further it comes out. Same thing with your head. If your head is directly on top of your neck, it's the easiest for your neck to hold. If it's an inch forward, 2 inches forward or more, it's just putting more and more strain on your neck. Over time, what can happen is that you can actually develop ligament laxity, not significantly, but still subtle, like ligament laxity that actually causes pain and causes muscle tightness. Now, physical therapy, by working on posture and helping you to kind of bring your neck back, is absolutely, you know, beneficial because we all want to have good posture. It doesn't do us any good to all kind of be like this. However, if you're kind of, like I said, if these symptoms like your neck pain, your headache aren't going away with physical therapy, it's time to consider that you might actually have an underlying ligament issue in which prolotherapy is the best treatment option. So prolotherapy in its simplest form is an injection technique that stimulates repair of tissue. So if you are someone that has some ligament weakness or some ligament laxity in your neck, prolotherapy actually works to strengthen those ligaments and provide more stability at the multiple areas of your spine, so that one, you can help get rid of pain. You know, if you ever sprained an ankle, you kind of like you've hurt that ligament, right? It's very painful. Same kind of thing can go on with your neck. In your neck, if that ligament is slightly injured, like I said, or weak, that can cause pain. The other thing that can happen if your ligament is slightly weak is that your muscles, all the surrounding muscles kind of in your upper back, in your neck, will spasm trying to protect that area. So oftentimes too, like if you have a lot of neck tightness, you know, kind of muscle soreness, or even you get like muscle headaches, that could actually be related to an underlying ligament issue that prolotherapy can resolve.